So not everyone needs LANAP, but here's how we decide. I hear it all the time. Doc, am I a candidate for LANAP? And while LANAP is a powerful tool, it's not for everybody. So today I'm gonna break down who it's perfect for, who it's not perfect for, and how we make that call. Hey, I'm Dr. Fatima, your friendly and your favorite board-certified periodontist, and I help patients keep their teeth for a lifetime using advanced technologies like LANAP. So let's get into it. First, let's get into a quick refresher. LANAP is a laser-based procedure that we use to treat gum disease so that we don't have to cut or we don't have to stitch your gum tissue like we do in traditional surgery. Think of it as like we're using a high-tech gardening method where we're actually only targeting the weeds, i.e. the infection, so that we can protect the good grass roots, your teeth, and give your gums a fresh chance to regrow. But just like LANAP is amazing, it's not for everybody. The number one factor that we use to determine if LANAP is good for you or not is your disease stage. Sometimes patients have early gum disease where their pocketing is 1s, 2s, and 3s. Your gums may be just a little bit red and puffy. You may bleed a little bit when you floss, but that's normally gingivitis. LANAP is generally overkill there. Just a thorough cleaning and some great home care may reverse it. But if you've got moderate gum disease where your pockets are 4s, 5s, and 6s, you've got infection that's created real pockets between your teeth and your gums. You might notice that you got bad breath, you got bleeding when you brush, or your gums look a little bit pulled away from your teeth. But that's where LANAP shines because it can clear the infection and stimulate the healing around your teeth to encourage some additional bone growth that you actually may have lost due to disease. In advanced gum disease, that bone is lost pretty severely. Your teeth are loose or the infection runs really deep. You may even notice that you've got pus between your teeth. But LANAP can still help there, but it really depends. Sometimes we can stabilize to save the teeth, but other times, extraction and implants are really only the smarter path. It may be a more conservative choice. But here's what I need you to hear. It is so dangerous to assume you just have gingivitis. You can't always tell by looking in the mirror. Gum disease is really sneaky. It's a chronic disease, it's a chronic infection, and real changes often happen underneath the gum line that you can't see. Only x-rays and a professional exam can root it out. That's why it's so important to see a periodontist to know whether or not you're in the early, the moderate, or the advanced stage. And let's be clear, approximately 35% of the population has some form of gum disease. So don't wait until your teeth are completely loose to find out. If you've noticed that you got bleeding gums, bad breath, or you got changes in your gums, get in for a consult. The sooner we know your stage, the sooner we can match you with the right treatment. Think of it as if you need house repairs. If you've got early gum disease, you might just think about the fact that you may have a little dust in the corner. You might want to bring in a cleaning crew or spend a little bit of a Saturday kind of cleaning up. That'll get rid of it, right? But if you got termites in the wall and the wood is starting to decay, you might need to call in a contractor. Hello, LANAP. But if your foundation is crumbling, sometimes it's just time to rebuild. Now let's talk medical factors. If you're a patient struggling with diabetes, LANAP can actually be the best choice for you because it actually creates less trauma, less bleeding, and it's often safer and more predictable than traditional surgery. As long as your blood sugar is well controlled though, that's super duper important. If you're on blood thinners or immune medications or any other prescriptions, LANAP can actually be a safer surgery because there's less bleeding and there's less post-operative discomfort. But we'll always coordinate with your physician to make certain that we're doing what's right for you. Now in pregnancy, we usually avoid elective procedures like LANAP until after the delivery of the baby. Your gums may bleed a little bit more during pregnancy because of hormonal changes, but quite frequently that can be managed with more frequent cleanings until it's safe to do laser therapy. So let's keep it real. Smoking and vaping, they make things really hard. They make it difficult for your body to heal. LANAP is actually more forgiving than traditional gum surgery in that respect, but results still won't be as strong as they are in non-smokers. So if you're thinking about quitting, LANAP can be a great fresh start for your gums and your lungs. Just do it at the same time. So listen, sometimes old school methods are still best. If bone loss is so advanced that teeth aren't stable, a surgical flap or even extraction and implants may be a smarter, more conservative choice. We don't do cookie cutter dentistry here. Every smile is different and we match the right tool for the right situation. But here's the bottom line. LANAP is an incredible tool, but it's not for everybody. It depends on whether your gum disease is in the early stage, the moderate stage, or the advanced stage. And the only way to know for sure is with x-rays and an exam from a periodontist. If you've got bleeding gums, bad breath, or your dentist has mentioned before that you got gum disease, please don't sit on it. The longer you wait, the harder it is to save your teeth. So here's what I want you to do. First, take my free 60-second quiz. The link is right below the video. That quiz will give you an idea of whether you're actually a candidate for LANAP and if it's right for you. Then I want you to schedule a consult with a periodontist, whether it's me right here in Dallas-Fort Worth or someone in your area. That visit will get you some real answers and make a solid plan for you, because your smile deserves better than guesswork. Let's figure out your stage and how to get you on a path to healthy gums and a confident smile. Now, if this helped, I want you to hit the subscribe button and share it with someone you care about, because gum disease doesn't just affect your teeth, it affects your entire body. So let's save some smiles together. See it? I messed up.
Oh, I'm sure I have headphones.
Oh, teleprompter. Okay. Okay, here we go. Okay. First, let's do a little quick refresher. LANAP, remember, is a procedure.